Dental Care of Baltimore is a Baltimore County-based dental office started by Dr. George Evans Sr. The dental office consists of two branches, one in Randallstown by Northwest Hospital and the other in Owings Mills, Maryland by Foundry Row. At the Randallstown branch, you would find Dr. George Evans Sr. as well as Dr. George Evans Jr. And at the Owings Mills Foundry Row branch, you would find Dr. George Evans Sr. as well as Dr. Kira Toulson, formerly known as Dr. Kira Evans. Today we'll be at the Randallstown branch, following around Dr. George Evans Jr., watching some of the procedures he does and having a sit-down interview with him. This branch consists of 4 operatories as well as 2 hygiene rooms and offers many different services that are high technology and modern in dentistry, such as same-day crown delivery with CEREC scanning. When you enter this office, you'll notice there's a very nice vibe. Everyone's very welcoming and friendly. There's nice music playing. And hey, you just might catch a dance or two from Dr. George Evans Jr.
An angel.
So since I got to the office after the first patients got there, I really kind of just jumped into recording, looking around, seeing what was going on. There were a couple procedures in progress. I watched one of Dr. George's assistants take a scan, getting ready to have a patient start their Zoom whitening treatment. Meanwhile, in another one of the operatories, Dr. George was working on a very complicated case, and he kind of got me up to speed on what was going on, etc. I honestly thought I was going to the office and I was just gonna, be recording, not really like shadowing or anything like that, but inevitably, Dr. George is a great teacher, and if you're gonna watch him do something, he's gonna explain to you what's going on. So he was in the room with a patient and he was explaining to me that he was doing a post and core. The patient had a root canal treatment done, but there wasn't really much of a crown left on the tooth. However, this patient was not the ideal patient to do an extraction on due to other medical circumstances that were in place. So Dr. George opted to at least try to do a post and core first, because that would have been a lot safer for the patient and, in order to retain what was left of the tooth. So I watched Dr. George first do a trough with a laser, which is something pretty cool that they have at the office. Most people would pack cords subgingivally or something like that, or at least that's what we would do at school with, our limited resources. But, it was nice to see something new, and I wanted to make sure I recorded that. And then watch Dr. George do a post and core. Once you put a post and core in a root, you have to prep it like it's a crown prep. So watched him do that. Then took the scan, and originally the patient was gonna get a same-day crown, which is one of the things that Dr. George offers at his office. But due to time constraints, the patient got a temporary crown and will be coming back for their permanent crown. Dr. George's associate was also in another room doing a crown prep and same-day crown delivery. I did not record anything from there just because I was kind of just wrapped up focusing on what Dr. George was doing. But I wanted to make sure I included this footage in the vlog so you guys could kind of see Dr. George at work and what type of stuff he does on a day-to-day basis. I remember doing my externship here, it was always seeing him do a lot of fixed prosthodontic work, a lot of removable prosthodontic work, which I didn't see any today, dentures, crowns, bridges, and I even during my externship saw a veneer case maybe 2 veneer cases that Dr. George had just completed. So lots of different things offered at Dental Care of Baltimore, and I think that it's a great experience for me anytime I go in there just to shadow, learn anything. Like, it's always a great experience. And for the customer, the patient, I think it's a very, very relaxing environment, and an environment that makes people want to come back to the dentist, which is one of the most important things. Everybody, much anticipated. This is Dr. G, Dr. George Evans Jr.
Yes,
like
sir.
I mentioned earlier, everyone calls him Dr. George because his dad is Dr. George Evans.
Yeah.
So I'm just gonna introduce him. He's a University of Maryland School of Dentistry graduate. Comes from a dentistry family. His sister is a dentist at the other branch they have. His dad started this practice. He'll tell you more about the practice, how it started and how long ago it started, etc., and like his path to dentistry. So without further ado, Dr. George. We're going to start off talking about the practice, and then we'll segue into your journey to dentistry.
Okay.
So tell us a little bit about like Dental Care of Baltimore, when it started, who started it, obviously your father, and how it got to where it is today.
Yeah. Well, yeah, again, my name is George Evans. I'm George Evans Jr. So everyone knows my dad is Dr. Evans, right? Even I think some family call him Dr. Evans. So he's, he's Dr. Evans to everybody. So when I came into the practice, my sister was here. She graduated from Maryland 2 years before I did. And at that time, her name was Evans as well. So we had 3 Dr. Evans in the practice at once. And so, everyone calls me Dr. George or Dr. G. My sister became Dr. K. She has changed the name since she's got married, so she's Tulsa now. But yeah, we joined up with my dad. We decided later on, kind of in our life and career, that we wanted to go into dentistry. Like, she went into public health out of college. I went into kind of a business route out of college, and I don't know if either one of us thought about being a dentist growing up. I mean, obviously, we were around it all the time, but, we kind of were trying to make our own path before we decided to go to dental school. And we kind of decided at the same time. We had been thinking about it independently, and then we just started having a conversation like, yeah, I think I want to go to dental school. And so, yeah, I mean, it was probably the best decision that both of us made.
So I know you told me back when I used to extern here, like you worked here you did like the front desk or like office manager type of thing.
Yeah.
But kind of what ignited that fire to make you, say, I'm gonna go back.
This is what I want to do.
Yeah.
Yeah. I ended up working as my dad's office manager. My aunt was his office manager for a long time, and she was planning on she was moving. She was planning on leaving, so I came in to help him out. Really, he had a need, and I was still trying to figure out what I wanted to do. And so I came in and I had a business background, a management background, and so I just came in, kind of jumped in as his office manager, not really knowing a whole lot about the dental business, but just kind of learned on the job. And it was really, that time period of me working as his office manager, learning about dentistry, learning about the business of dentistry, is kind of what fueled me to want to go to dental school and be a dentist. I kind of knew I wanted to be an entrepreneur. I knew I wanted to kind of do things my way and run my own business, and I just thought it was a perfect opportunity for me to go into a business that was already established. And also, just seeing the relationship my dad had with his patients was probably a big thing. His patients, he's had the same patients for years, built a relationship, and they really loved and respected him, and so I thought that was pretty awesome.
Mm-hmm. So how did you? Because my channel is kind of predicated on like the non-traditional path, since I took the non-traditional path.
Yeah.
So for someone like you that majored in business, graduated college, started working for years, how'd you go about going back to school so that you could kind of change your path?
It was a challenge because you think about what kind of commitment it's going to take to go back to school and do that. I was already in my late 20s when I was even considering it. You just think about how much school it is, going back to school and learning things that you hadn't seen or talked about in a number of years. And so I think it was just a leap of faith. Just had to commit to it. And so I just started taking, I took one class at first at a community college, just to kind of get back into the routine of studying. But then after that, I enrolled in a post-bacc program, which was a 1.5-year program where I got all my prerequisites in.
Okay.
And so once I started that, I committed to that. I was pretty much a full-time student. And so working, really just didn't do much working at that time. Still working a little bit part-time, helping my dad out when I could. But yeah, just making that commitment and and doing that post-bacc program.
So what about like the DAT? Like how hard was it to challenge that test after being, out of school for
Yeah.
years at a time, as well as I think it's important to note that when you were in college, you weren't taking science classes if you major in business.
Yeah.
So
Well, so I had a little bit of background in science, because even though I got into business, when I first started undergrad, I didn't know what I wanted to do. So I had started taking some of those basic science classes, but I ended up retaking everything.
Okay.
But by the time I got to the DAT, I was already pretty locked in, class-wise, from the post-bacc program, because it was all in a course of a year and a half. So it was tough at first.
Yeah.
It was tough getting back into algebra, chemistry 1 and 2.
Yeah.
Having to do a lot of algebra there, but and then being in classrooms with 18 and 19-year-olds. I don't know. I think the whole thing is different for me. Is I knew exactly what my goal was,
Right.
And that's how I was able to stay focused, right? And it's different from when I did it the first time. I was pretty focused and committed at that time.
Yeah, I always tell people I'm thankful for the gap years I took, because when it came time to go to dental school, like I was focused. I knew what I wanted to do. I was way more mature than I was in undergrad. Like I was ready for that challenge, and I knew it was going to be a challenge. So I feel like age was a pro for me.
Yeah, no, I agree. I think dealing with professors was different as well. I could really just kind of talk to them and relate to them as more of a peer. Than as someone that you kind of placed on a pedestal that you're afraid to approach, or whatever your challenges are when you're younger.
And then plus, like, you working at the dental office and knowing what type of services you offer, what type of services bring in good money. You kind of know like what you want to get out of the program when you're
You mean once I got to dental school?
When you're in
oh
dental
yeah,
school,
for sure. Yeah. And so that was a thing too. Like everything was already like laid out. I knew I wanted to go into practice with my dad. I knew the type of treatment or office and services that he offered. So, it was way more focused.
Yeah. I feel like even now, recognizing like being in dental school, I always say like it's what you make it. So your school might require. At my school, you're required to do 10 crowns, right?
Yeah.
But if you have so much experience in the dental office, and you know what a crown pays versus a filling, and a lot of the name of the game in dentistry is chair time. So your speed matters.
Yeah.
Obviously, someone like you that knows that already, you're keeping that in mind when you have your patients. You're like, obviously you're going to do your fair share of fillings in dental school no matter what.
Yeah.
But when it comes to those crowns, you're like, I need this practice.
Yeah.
You know what I mean? So, and then like, same thing, like for me at my school, I think a big selling point with my school is that they allow you to place implants in pre-dot.
That's nice.
Yeah.
Yeah.
Like
Because
a
lot of
those
dental students, even out of school, it's hard to get that experience.
Yeah. So, aside from that, how do you remember when your dad opened this branch, and like when you opened the other branch as well?
Yeah, so actually he opened his office originally late 80s, and he had an office for about 20 years. And so we didn't actually open this particular office until I started talking about dental school.
Oh, okay.
So we moved into this space around that time.
Okay.
So I was the office manager, and it wasn't far from here. Just a smaller space, an older building, and that would have been fine for him to retire in.
Right.
But once he found out, we decided that was the path I was going, the path that my sister was going. We thought it was a good time to move into this place. So it's been, I want to say it's 11, 12 years now in this location. So what does that put us at, like 2011, 2012? We opened this office. And then 2018, after I finished school, my sister was finished school, we opened up a second location in Owings Mills.
Yeah, and the other location is in Foundry Row. Keep in mind, they started building Foundry Row when I was in college. So, I mean, the Foundry Row is an area that just came up probably in around like 2014, 2015. Yeah. So they're one of the first people to get established in that area.
Yeah, it's a Life Bridge building. So we're connected to the Northwest Hospital. right? And so when they opened that location, they let us know that they were opening it and gave us opportunity to go into have first dibs as a dental office in that building. It's nice to be in an area where you have other medical professionals, because people walk by all the time. We get referrals from the other doctors, people who need clearance for surgeries. You know, we're kind of one of the first offices that they'll contact.
Okay. Yeah, that's what's up. So I briefly mentioned it earlier, but if you could tell them about like some of the services that you guys offer here, especially like your selling points that gets people in the door.
Yep.
So, you know, just so they can kind of understand when they're watching the video what they're seeing.
So one thing I got from my dad when I was working in the office before dental school was he did most everything, right? He didn't refer out a lot of procedures. And I realized his patients really like that, right? They like to be able to go to your general dentist and not every time you need a root canal or every time you need an extraction or whatever it may be, have to be referred to someone else. Most people don't like the dentist. And so once you become comfortable with one person, you want them to be able to do everything for you. Now, obviously, you know, we can't necessarily do everything, but I think that was his main focus, was to try to offer as many services as he could in-house without having to refer. So I saw as he got into doing cosmetic work, he went through a program to, you know, to enhance his skills as a cosmetic dentist, doing veneers and reconstructions. I watched him as he got involved with implant placement. He always did his own root canals. And so I just kind of took notice of that and decided that that's how I wanted to do as well. Just kind of continue what he was able to do. Now, obviously, coming right out of dental school, you don't feel comfortable doing everything. So, you know, it really, first few years, and even still now, I really focused on my clinical skills. I had the business background already. I knew how to run, I knew the business side of dentistry. I knew how to run an office. And so I really just focused on my clinical skills. I knew in dental school I wanted to do as many root canals as I could, because you know, it's business-wise, it's nice to be able to do your own root canals and crowns. Patients call all the time in pain, right? And if you can save the tooth, you can do a sometimes root canal and crown right there on the spot, right? If you're not busy, you can always be busy with that type of treatment. So I do root canals. Most all of my root canals. I do refer retreatments and those kind of things, but we do offer also same-day crowns where we do it digitally.
Right.
I think that's a great service. Patients love the fact that they can get their crown the same day. If you ever had a temporary crown, you realize how much it sucks. Temps come off, they don't fit well.
That's what we did with that school.
And so, you know, a patient can leave with their permanent crown the same day, they're excited about that. And so permanent crowns, same day crowns. I did get into implant placement. And so that was one of the first things I did. I took a implant course. It was a maxi course. It was a year-long program where you really got involved in learning placing implants. And so single implants I started with and kind of graduated to doing all on X full arch implants. I also did a cosmetic course as well, learning how to design veneer cases. So
that's a big thing in dentistry now.
I mean, people, that's something that you see all the time, right? You're on Instagram and all the celebrities are getting veneers and they don't all look the same. Some of them they don't look so great. And so anybody can do a veneer, but I think it's, you know, I think continuing education is important. You got to learn how to do things the right way. And so but veneers is being able to change someone's smile. I think that's one of the biggest joys when it comes to doing dentistry.
Definitely. Another thing I saw here a lot, well, not, I wouldn't say a lot, but I saw it today and I saw it a few times during externship, is the Zoom lightning.
A
lot of, I wouldn't say a lot of people don't offer it, but you don't see it too often, especially when people want whiter teeth. They're just going to go straight to veneers. Like, a lot of people aren't really concerned with keeping their own teeth and getting their own teeth in the best shape possible. But you know, those are all great things to offer.
No, that's true. I mean, sometimes just whitening your teeth can make a big difference. Gum contouring, you know, just kind of making your teeth look longer. So, you know, it doesn't always take veneers to change your smile.
If you have any advice for like the dental students out there, someone like me, that, you know, when we graduate, or, you know, we may not have as clear of a vision as you did going into dental school or while you were in dental school.
Yeah.
So what's your advice for like a third or fourth year dental student, someone that's in the clinic or about to enter the clinic, and they're trying to figure out, you know, what do I even need to get out of dental school type of thing?
You know, I think the main thing is to just talk to as many dentists and practice owners as you can. Seek out mentorship. I think that's important. What you'll find out is everybody runs their practice a little bit differently. There's different models of how you want to run your practice, from a like a high volume, multiple hygienist type practice. And so, you know, in that practice, you're going to have a larger space. You're going to have a lot of treatment rooms. You're going to be seeing lots of patients. To me, I think the quality of care maybe goes down a little bit, but that's, you know, I may be biased in that because my practice is run a little bit differently. But, you know, you just got to figure out what works for you, because it's all, you know, it's all a little bit different.
Yeah.
But yeah, definitely mentorship early on. It's never too early to talk to. And I don't, at your school, you have part-time faculty that's also in private practice.
Yeah.
Yeah, those
a
are
lot of them
are
like that. Yeah.
Those are great people to talk to, right? Because they're not just, you know, in education. You know, they're out there in the real world practicing. So definitely seek that out.
A lot of my professors work in private practice as well.
Yeah.
And very resourceful.
Yeah,
I would say.
You know, the business of dentistry is something that you really won't learn until you get out of clinic, out of dental school. I mean, you can get by visiting practice to get a good understanding, but I think the biggest thing in the beginning is just focusing on your clinical skills. Yeah. Right. Finding out what your niche is that you want to have. Really, just learn as much as you can.
Well, we appreciate you, Dr. G.
Oh, no,
definitely drop some gems for the channel, for everybody that's watching. Is there any way they can contact you, Instagram or like email, if they're looking for mentors, or maybe like someone that's in the area that's looking for a dentist to shadow?
Yep.
If you guys are open to that.
Yeah. If you want to contact me, I'm Dr. GEEDDS on Instagram, or at Dental Care of Baltimore on Instagram. Website is Dental Care of Baltimore. You know, just reach out. I'm always available. Eli did a externship with me a couple summers ago, so I'm always open to give back what I can.
Yeah. I also wanted to mention, I thought I was coming here just to record today, and I end up learning unintentionally. I end up learning because he's still teaching when he works.
Always.
But I'm always super appreciative of that, because dentistry is a continuous learning process, like you mentioned. Even when you graduate, CEs, extra courses, learning how to do.
That's what makes it fun.
Things.
Yeah, that's what makes it fun. You gotta always want to keep learning. Yeah,
and that's why, like I mentioned in previous videos, you gotta go into dentistry because you really want to and you really like it, not just for the money. You know.
Yeah. There's probably easier ways to make money.
There's definitely easier and less debt accumulation on the way.
Yeah, you gotta enjoy it.
Yeah. All right,
cool.
So I hope y'all enjoyed a good day at Dr. G's office like I did. I feel like that video was very informative, very helpful, and I hope y'all got something out of it, because that's what we do on this channel, you know. So thank y'all for watching. Hope to see y'all in the next video. Make sure you subscribe, watch some more dental school vlogs, and I'll be seeing y'all later. Peace.